More and more men are being diagnosed with prostate cancer because they're being screened by their general practitioner. But the big question is, which prostate cancers need active treatment and how aggressively? Lorelei Mucci and her colleagues at Harvard School of Public Health have been looking at genes, blood tests, and indeed coffee consumption to see if doctors can better predict which men may have a nastier form of prostate cancer.
A lot of the work that we've been doing has been focusing on those markers in the prostate itself. So looking at the tumor characteristics, looking at levels of genes or proteins within the prostate, and using that information together with information on man's stage and grade of his disease together to better inform on risk prediction of lethal prostate cancer.
And you're finding that a breast cancer gene, or what has been known as a breast cancer gene, is activated in some of these men who are going to develop the lethal cancer. And it's not in their bodies, it's actually in the tumor.
Yeah, that's right. So we looked at the tumors of over 1,000 men with prostate cancer, and we were specifically looking for the protein marker BRCA1, which is the early onset breast cancer gene number 1. And we found actually that about 15% of men in our study with prostate cancer, their tumors were showing this marker in their tumors. And what was really interesting was those men were more than twice as likely to die of their prostate cancer compared to the men who did not have tumors that were showing this marker. This prediction of lethal cancer provided more information than just knowing the grade of the cancer or the stage of the cancer. And
these men weren't carrying this gene, they weren't born with it like like women with early breast cancer. It was triggered in the cancer itself.
That's exactly right. It's not an inherited factor, it's something that happened as a result of the tumor.
So where you might get to is a cocktail of tests that might tell a man whether or not he's at risk of a lethal cancer.
I think that's exactly right. I think that it's not going to be just one marker, but really it's going to be several different markers. It may be a combination of markers in the tumors as well as inherited markers as well altogether. And I think you're right. I think there's going to be several markers together.
And you found coffee is a predictive factor.
Right. So we performed a study in 50,000 men in the United States looking at coffee consumption. And coffee is a very interesting dietary factor. It's one of the most, it's one of the strongest antioxidants. It also has been shown actually in randomized studies to help control insulin. And it's also been shown to have anti-inflammatory properties. Antioxidants, anti-inflammation, all are really interesting pathways that we're interested in terms of preventing lethal cancer, which is why we're interested in study coffee. And we did find that the men who drank even 3 to 4 cups per day had a 30% lower risk, specifically of lethal prostate cancer compared to men who didn't drink any coffee. What was interesting, both in the US men and in the Swedish men, was that prostate cancer was a more substantial contributor to cause of death among men with prostate cancer, particularly before PSA screening was introduced. And so the rates of dying of prostate cancer among men was much higher, and it was a much higher proportion of the total causes of death.
So what he's saying is that PSA testing has been associated with a reduced death rate from prostate cancer?
I do believe, there's a lot of debate on this topic, but I believe that the results from the European randomized trial of prostate cancer screening do show a benefit of PSA screening in reducing mortality from prostate cancer. I think that
it just comes at a cost.
It comes at a substantial cost, exactly, and that many, many men are getting diagnosed with a cancer and suffering from many issues of quality of life associated with that diagnosis and the treatment. So absolutely, it's one of the big challenges in oncology.
But that notwithstanding, if you've got prostate cancer, you're almost certainly going to die of what everybody else dies of.
That's right.
Heart disease and cancer.
Exactly, absolutely.
And that's the message.
And that's the message, yeah.
And you've been looking at sexually transmissible diseases and prostate cancer.
We've been very interested specifically in one sexually transmitted infection, which is trichomonas. And what's interesting about trichomonas is that it's in men asymptomatic. So it doesn't cause
because of vaginal discharge in women.
Right, but relatively no symptoms in men. And so most men who are infected wouldn't know they have the infection. It has been shown to be able to ascend to the prostate and cause a local inflammatory response. And the other interesting thing is that men who are infected one time actually can get reinfected several times after that. So it's in terms of an infection potentially leading to inflammation in the prostate and that then leading potentially to cancer. It's a very interesting model of an infectious agent. And so within our own study, within a cohort of men from the Physicians' Health Study, we found that the men who were infected previously with trichomonas based on a blood marker had a 2.5-fold increased risk of lethal prostate cancer compared to men who did not have infection. We've looked at other sexually transmitted infections such as HPV, chlamydia, and we have not seen those associations with increased risk.
The message here is, if a partner of yours has trichomonas, men should be treated for it.
Well, I think
or looked for it.
I think we wanted more research is probably needed to really understand specifically, is it trichomonas or is it a marker of some other sexually transmitted infection that we haven't studied yet?
That's all for this week's Tonic. For more information, to see some segments from today's show and useful links, you can go to tonictv.com.au. See you next time.